The main focus of the keto diet is about achieving the state of ketosis. Once your body makes the switch to producing ketones and burning fat, there are subtle changes that may take place. And in this lesson, I want to share with you these changes so that you know what to expect when you start the keto diet. Let's cover the basic question that's on everybody's mind first. How long does it take to get into ketosis? Your body must first use up the glucose in your blood and all the glucose stores. Once that is depleted, it can start converting your fat into energy, enter ketosis, and start producing ketones. This process will usually start within 3 to 5 days of the keto diet. It depends on the individual, of course, on factors such as body type and body weight. But it is possible that within 3 days you can start to experience the benefits of the keto diet. Unfortunately, there is no external factor visible to determine you are in ketosis. There are subtle changes that you may notice. And here I will cover 6 ways to determine when your body has reached ketosis. The first one is mental clarity. You may find yourself feeling more focused and getting work done faster and easier than before. The reason for this is that ketones are an extremely potent fuel source for your brain. So you may notice that you are reading faster, remembering facts and figures easier, or just getting to work and getting it done. You may experience ultra productivity. Now the second factor is quite easy to notice, and that is you are losing weight. Once your body taps into fat for energy, you should see a rapid decline in body weight. When this happens, it is quite possible that you will feel worse and have less energy, but you will be losing weight. The third way is quite unwelcome, and that is you get bad breath and your urine smells. I will cover details of why this happens in another lesson. But basically, your body needs to get rid of excess ketones. And one type of ketone is acetone. This smells like nail polish. This is not a reason to be alarmed, but rather to be aware that it is a sign that your body is in ketosis. To fix your breath, try chewing some sugar-free gum. And make sure you always have it with you. The fourth way to know you are in ketosis is experiencing appetite suppression. You will feel full and you will not want to eat as often. Generally speaking, you may feel as though you have enough energy to survive without food. A severely reduced appetite and a lack of hunger will also increase your daily calorie deficit, so you will lose more weight. Now here's another way of testing if you are in ketosis, and this involves peeing on a urine strip. You can buy these strips at most pharmacies or online. And this involves peeing on the strip and checking the color of the strip to determine your levels of ketones. It's an easy and affordable way to check if you are in ketosis. Be aware that the longer you have been in ketosis, the urine strip's accuracy will decline. That's because the longer on ketosis, your body becomes more efficient at using ketones for energy. And this urine test can indicate a lower level of ketones that are actually in your body. There are other factors that make this test less reliable, and that includes your level of electrolytes in your body and how hydrated you are. So we have just covered 5 ways for checking for ketosis, and these are easy ways and I suggest you stick to them. But there is one more method. It's a little bit more dependable, but it's also more complicated, and this involves testing your blood for ketones. As your blood glucose stores are depleted, your blood will start to contain ketones. So you can test your blood and see how much ketones are present. But this is more expensive, as you will need to buy a blood monitor and you will have to prick your finger to test your blood. For that reason, I believe the first 5 methods are much more sufficient when you're doing the keto diet.